Yep.
Well, welcome. We have a very special afternoon planned. We're just going to have some folks join us. So if you are not on the panel, if you wouldn't mind muting yourself, and feel free throughout the panel to ask any questions by clicking into the chat box, and we will keep an eye on the chats and try to answer all of your questions in the time we have allocated. Welcome everyone to the Pedal the Cause Coronavirus, What People with Cancer Should Know. I'm Stacey Abelies. I am the Director of Development at Pedal the Cause, and I am happy to welcome all of you today. Before we get started, I'd like to introduce our panelists, and I'm just gonna go by the order that I see on my screen. So starting with Dr. Ryan Fields, Professor of Surgery, Chief of Surgical Oncology at the WashU School of Medicine.
Hello, everyone.
Hello, Dr. Fields. Next, I see again on my screen, Catherine Glover Collins, MD, PhD, Assistant Professor of Breast Surgical Oncology Surgery in the section of Endocrine and Oncologic Surgery at the Washington University School of Medicine. Hello, Dr. Glover Collins.
Good to be here.
Thanks for being here. Next, Dr. Amy James, PhD, MPH, and MA, Professor at the Washington University School of Medicine. Hello, Dr. James.
Hello, thank you.
Hello. And last and certainly not least, Dr. Joshua Rubin, MD, Professor of Pediatrics and Neuroscience at the Washington University School of Medicine. Hello, Dr. Rubin.
Hello, everybody.
Okay, great. Well, welcome everyone again. We're going to go ahead and get started. My colleague, Eleanor Gedeke, is monitoring the chats from both Facebook as well as via Zoom, and we'll be sending them along. So if you have any questions along the way, please post your questions in the chat box for everyone to see. So let's go ahead and get started. We have a lot of questions on our minds today about coronavirus and those impacted by a cancer diagnosis. So let's go ahead and dive right in with a question on everyone's mind. Let's start with Dr. Fields. If you could, in layperson's terms, just tell us exactly what is coronavirus, or more what we're seeing on the news, COVID-19.
Sure, and I'll start by expressing sentiments for everybody. It's a pleasure to be here and try to help out during these challenging times. I hope everyone's safe and well, and we're all here to support the Siteman family, the Pedal the Cause family, and I will also say, we've tried to assemble a group of people here who have some complementary expertise. There may be some questions though that we don't know the answer to, but that we can follow up on. That being said, I've learned a lot about coronaviruses, and I feel like I get another degree now in infectious diseases, but in general, coronavirus is a virus like a common cold or flu type virus that causes those types of symptoms. It's hard to distinguish without the actual test, one versus the other, which is why it's been difficult to separate the flu from coronavirus, but it's predominantly spread by respiratory droplets and close contact with an infected individual, not spread, say, through the water supply or the food supply in terms of contaminated food products or things that other viruses may spread. So this is, the reason why some of the containment measures that we'll talk about are effective in controlling a predominantly respiratory virus. And one thing that's important to know is that the virus itself isn't necessarily what causes people to get real sick and potentially die. It's sort of the body's reaction and the inflammation that happens, and especially in patients that may be older or have other illnesses or weakened immune systems that then just can't overcome that big inflammatory response. So the treatment is essentially supportive. It's the ventilators, it's the respiratory care, it's the controlling the fevers and supporting the other organs. It's not at this point treating the actual virus itself. It's more treating the symptoms that it causes.
Great, well, thank you. I think that clarifies that for everyone. I think a lot of what we're seeing is a 24-hour news cycle and a lot of information being spread. So it's always helpful to hear from the experts exactly what we're looking at. So let's talk a little bit about the coronavirus. And we're all sheltering in place and we're told to socially distance. And can you talk about, Dr. James, a little bit why it's important to social distance and why that's important in containing a pandemic like COVID-19?
Right. So as Dr. Fields already said, you know, coronavirus is spread through close contact with others, and this idea of social or physical distancing, it, you know, it really reduces the chance that we will encounter someone who's infected and get exposed to the virus. And it also reduces the chance that someone who is infectious will come into contact with other people. So by creating that physical distance, by staying at home, and reducing our interactions, we're protecting ourselves and we're protecting our families and the community as a whole.
Thank you, thank you. Dr. Rubin, we're going to move a little into the impact of coronavirus on someone with a cancer diagnosis. So can you speak to our audience a little bit of if they are with a cancer diagnosis, what steps do they need to take to protect themselves?
Sure. I think first off, the actions to protect yourself are really the same as those of anybody. There is no direct treatment for the virus, so protecting yourself from getting COVID-19 is really the best thing that you can do, and that, to the best of our ability, is through social distancing and through wearing face masks and through trying to avoid touching your face, and through washing your hands and taking measures to protect yourself from the things that come into your house. In our own house, every package that comes in is washed down, even everything we get from the grocery store every week. These things will protect you from COVID-19. I think that there are obviously special stressors on cancer patients with regard to a pandemic like this. Not only is there the anxiety and fear around what if I get this and what if I'm immunocompromised from my treatment, will it be worse for me? But there's also, what do I do if I'm suddenly sick in the way that I've been told requires that I go to an emergency room? How do I protect myself then? Are the guidelines the same for when I should be accessing emergency services as they were before? What do I do about surgeries that I was going to have that are not necessarily urgent surgeries, things like removing central lines? What do I do about the isolation? I've been buoyed in my cancer battle by being able to see other people, even other patients in the waiting room, certainly my care team. All of these things are additional stressors on cancer patients. I think the simplest part of this is the protection from the virus itself, because those measures are really no different than they are for anybody else. I hope that answered your question.
Did, and as you were speaking, we had a lot of questions pop up on the chat box. So I'm going to open this up to Dr. Rubin, but really any of the physicians and researchers on the panel. So I'm just going to kind of paraphrase a couple questions because some of them are similar. So the first question we received from N. Porter was about when the shelter ban and social distancing is lifted, should he be going to work while on chemotherapy? And there's an infusion of chemo every other week. So can we talk about active treatment and kind of how to handle that moving forward in the world we're currently living in?
Sure. Would you like me to start?
Yeah, please. And anyone else, feel free to chime in after Dr. Rubin.
So, clearly the first concern is about immunocompromise, but it's not the only concern. Much of our chemotherapy also affect what we would refer to as barriers from infection, particularly the mucosal barriers of your mouth and your throat, but also skin barriers. So there are reasons to think that you may be more susceptible to virus getting in, and there are reasons to think that you might not be able to mount an adequate immune response to the virus. There are multiple things that modulate our immune responses to things. Some of them are genetic. clearly we all know people who get every cold that comes through and people who never get colds that come through. Age is a big consideration when thinking about immune response. Immune response tends to wane with advancing age in everybody. It tends to wane more in males than it does in females. So all of those things are considerations. And then on top of it, it's the kind of chemotherapy you're getting. It's the intensity of the chemotherapy you're getting. And if you've completed chemotherapy, it's how long ago you completed it. And, you know, I think that as an oncologist, we think about these things obviously all the time. Particularly, we think about after therapy is over, when, for instance, in a child, who I think about most, would it be safe to continue vaccinations? When is it safe to not wear a mask and go back to school? We've been thinking about these things for years. We have some general guidelines. They are not patient-specific guidelines, so they're meant to be applicable to any child. And I say that because that doesn't mean they're optimal for every child. They are guidelines that are applicable. And we think about sometime between 6 months and a year after intensive chemotherapy that patients are immunocompetent again. I think in terms of the barrier kinds of functions, you can do things to help yourself. Good skincare, particularly with lotions, so that you are protected against injuring your skin. People with dry skin tend to scratch. People who scratch tend to give themselves small injuries. Protecting yourself in that way with lotions is important. It's not clear, as Dr. Fields was saying, much of the symptoms of COVID-19 are actually a consequence of body response to the virus. There are certainly viruses in which the immune response is as much a factor in how sick you get as the virus itself. And so I know there are many people who are immunocompromised on this call right now, and there are many other populations of patients who are immunocompromised, those with autoimmune diseases, rheumatologic diseases, who are taking biologicals for their conditions. The general recommendation has been to avoid immunosuppressive agents, but there is a conversation about whether some of them might actually be advantageous. I'm not suggesting that it's better to be immunocompromised for 1 second. I think that it's not 100% clear whether or not all immunosuppression is equivalent in terms of the risk for the severity of COVID-19.
And Josh, there've been a lot of questions that kind of get at one of your points, and that's, you know, a number of people have asked, you know, I had cancer and I've been off treatment for, you know, anywhere from a couple months to a couple years. You know, am I still considered immunocompromised? And I think the general answer is probably no. Your immune system's recovered at that point. And then one thing I think to Josh's point is, you know, a lot of the people on this call who are being treated at Siteman, you know, have somebody that's leading their team, have a main physician that's looking after them. And so a lot of this is going to be individualized, getting at what Joshua said. What's your risk of developing this, and what treatments are you on? And so what are we going to recommend to you in terms of going back into society, interacting with others? I'd be curious to hear from Dr. Glover Collins about what she's been telling her surgery patients, meaning patients that are either scheduled for surgery or have had recent surgery, about particular restrictions and that sort of thing.
So basically, for my patients that have just had surgery, their restrictions are pretty much along the lines of social distancing, make sure you wear your mask, because those patients have generally been out of chemotherapy for 4 to 8 weeks. So their immune system is basically recovering still, potentially to some degree, but basically just follow your own, the restrictions that are out there. In terms of patients that have yet to undergo surgery, definitely, since our restrictions right now are for patients who are coming off of therapy, we want them to stay home, only come out when you need to, and have that conversation with your cancer care provider as to, you know, what are my risks? Am I on immune compromised drug? So that I can know what I need to do.
Great,
If
thank you.
If I can just
Dr.
add
James.
to the comments that have been made, is that when we do start to lift the social distancing recommendations, we still all have to be careful about where we go and what we're doing. It's not, you know, it's not going to be a magic change overnight that all of a sudden it's okay to go out, that you know, those restrictions will, for everyone in the population, you know, ideally those are going to be released gradually, and still with caution once things start to return.
And this is a beautiful segue, because the next question was actually for you, Dr. James, and the question was about just the additional risk for contracting the coronavirus if you are a cancer patient. So maybe talking a little bit about those risk factors, but to your point, once the bans are lifted, just additional safeguards that patients and caregivers can take to just ensure extra safety, or just lessen the anxiety of actually leaving the house.
And sometimes you're right. It's all about, you know, that anxiety that about and the worry about contracting coronavirus and COVID. And I thought, you know, the clinical doctors did a really great job talking about that, that risk and the extra things patients need to do. I think it's maintaining that distance, it's washing your hands, and knowing, as Dr. Rubin said, that the more we wash our hands, drier they get, and we can crack our skin and create other problems. It's also about being aware about who comes into your house, who comes into your that 6 foot distance, and where they've been, and sort of reminding the people around us who are often taking care of us, or we're taking care of other people, that they need to be careful as well. I'm not sure if that got at the question or not.
I think it did. I mean, I think, you know, for everyone, once the ban is lifted, people are going to take different actions that make them comfortable. But I think what you've all touched upon is at Siteman, and I can speak as a former caregiver, you're really part of a team, and you really need to trust in your team. So if you have any questions, you need to feel what's good and what makes sense to you to lessen the anxiety, but you also need to connect with your team and make sure that they're on the same page as far as extra precautions that you need to take, both as a caregiver and both as a patient, to ensure the safety of everyone moving forward. So I think you did touch on it, so thank you.
I just add one thing just on the messaging. You know, I've been pretty proud of the city of St. Louis as a model city in terms of preparing for this at the healthcare system level. The ability and the fact that essentially competitors like Barnes and Mercy and SSM and St. Luke's have come together to try to make the messaging consistent and share resources and share data has been exceptional. And it's not something that's happening everywhere. And I think what that has allowed us to do is take something where there's so many unknowns that when something gets found out, something gets discovered and is good quality advice, it's being given off at that level, so that you realize it's coming from multiple sources, and really allows us to say, okay, do this, don't do that. Now it's okay to relax this or that. And whether that's, you know, we're going to allow social gatherings now, and from a healthcare system, we sort of think that's a reasonable thing, or we're getting more PPE, more masks from one location to another. It's just been really good to see the community come together and accomplish something like that.
Thank you, Dr. Fields. So Dr. Glovers-Collins, the next question is about continuing with treatment. And I know you talked about that from a surgical perspective. Can you talk a little bit more about continuing with treatment during COVID-19 and the importance of working with your care team to make those decisions?
Absolutely. And I've been in contact with our medical oncology colleagues, and they are absolutely in tune with trying to minimize any risk for their patients that are continuing on therapy. And I think, as we've kind of stressed already, that this has to be an individual decision. You should talk to your cancer care provider and find out if you absolutely need to have to come and take your treatment, and what are safe intervals to be receiving your therapy if we're straying from the standard of care. And then when you do come out again, practice the social distancing, hand washing, masks, and things of that nature.
Josh, what about people on clinical trials?
Perfect. That's a great follow-up question.
Well, we have been continuing, of course, to treat anybody on a clinical trial. But we have changed our enrollment to our clinical trials a little bit. Whereas in the past, because we have a large pediatric brain tumor program and we frequently do second opinions and then enroll patients outside our local catchment, we've had to decrease that activity. I mean, it's much more difficult for families to travel. It certainly would be much more difficult forth between wherever they may live and St. Louis for clinical trial activities. And that's been hard because sometimes we are offering care that they can't get other places. But we've had to do that because it's just not possible to sustain that sort of back and forth. And the trials themselves require a lot of direct contact with physicians here at St. Louis Children's Hospital. But we are still enrolling patients from our local catchment. So City of St. Louis, State of Missouri, Western Illinois, Southern Western Illinois, primarily. We're offering, care to anybody that can, relocate themselves here. But it is different than before.
Absolutely. And kind of following up on those questions about our youngest patients and the pediatric oncology world, Dr. Rubin, can you talk a little bit about, to your point, procedures, not only trials that have been delayed into the summer months? From a parent's perspective, should they be worried, or what should parents be doing to be caring for their children with a cancer diagnosis right now, and just the overall protection of their kiddos?
So first off, we would not delay anything that would have an impact either on cure or an impact on comfort and quality, of significant impact on comfort and quality. Nothing would be delayed. We are caring for our patients the way we always care for our patients. It's really just a question of our ability to care for patients who don't live in our area. So there would be things that could get delayed. And as I mentioned before, it would be surgeries like to remove a central line that was no longer needed. That's a surgery that would get delayed. But anything that was impacting on cure or substantially impacting on comfort and quality of days would not have the same delays. With regard to caring for your children, I think that among the most difficult things is social isolation for children is a very different experience than it is for adults. Adults that are continuing to work at home also have the added stressor of having to care for their children while they're working, something that, except for the newborns and toddlers, is not something that parents generally have to deal with. And on top of it, parents have to be teaching their children, the younger children anyway. And so I think in caring for your children, the most important things are to try and address the anxieties that they have around this time, because I think children are really experiencing a lot of anxiety at the moment, all children. But certainly a child with cancer may also be fearful about, will this change my treatment? And will also be suffering the loss of contact. I can tell you that the relationship between nurses and our patients, for instance, and the physicians and the patients, but I think the parents of patients know what I'm talking about, become very important to the sense of well-being for our patients. And I think there's a real loss there for kids. So I think most of what needs to be done additionally is just dealing with the impact of the isolation, loss of contact, and any anxiety and fear the child might have about how it impacts on their care as well.
And I would say, you know, as physicians and providers, you know, we were almost all universally used to interacting with patients face-to-face in an office building. And we've changed and become pretty facile at some of these telemedicine visits that use platforms like Zoom so that we can, you know, continue to interact with patients virtually when a lot of the care may be a discussion on topics like this or review of a CAT scan or imaging, but where we don't necessarily want to bring them into the clinic because of the risk of exposure of both the patients to the medical center, but also of the staff at the medical center to people in the community who may be asymptomatic carriers. So the less we can do that, but the more we can continue to communicate with ways like this that are part of the medical record and part of the treatment now, I think are some pretty incredible things that are advancing very quickly and we're learning, but we're using and is really helping patients. It's helping efficiency. As an example, you know, normally if I had a new patient that I was seeing for melanoma, let's say on their arm, you know, they would come in, I'd examine them, we'd talk about things, then a week later, they might have surgery. Well, now I'm doing most of those visits by telemedicine and they can hold their arm up to the camera and I can see it and they can send some pictures and then we talk about the surgery. I can diagram things and point and talk on Zoom like this and we basically have a virtual clinic visit. And then I'll meet them on literally the morning of surgery a week later and do a full exam and make sure there's nothing surprising. But I would say, you know, for those types of cases, we can do a lot of that virtually, minimize the risk and still take care of the cancer patient as we normally would. So those are the types of strategies that we're able to use now too, to get at some of the things Josh was talking about too, to still maintain that relationship with the patient, still be interactive, still support them and their families and minimize risk.
Absolutely. So I'll ask this question of the group because Dr. Field, you're talking a little bit about, you know, telemedicine and different opportunities to engage with the patients. Outside of their care regimen, one of the questions that we seem to be getting is, you know, seasonally, we're in St. Louis and it is also allergy season. And how are you able, either via telemedicine or in person, able to discern if someone is presenting symptoms? How do they discern between an allergy, an allergic reaction, and COVID-19 symptoms? So how are you all dealing with that as we approach spring in St. Louis?
I guess I would say, you know, big picture, you know, a lot of the symptoms may overlap some, but in general, you're going to get the more flu-like symptoms with COVID-19. You're going to have that sort of cough and not necessarily the runny nose type symptoms of allergies. You'll have more of kind of the sore throat and the fever. There's a lot of people who have experienced this loss of taste and smell very early on, things that would be very different than allergies. And a lot of people can kind of get allergies seasonally and they remember what last year was like and it'd be similar this year, whether it's the watery eyes or the runny nose sorts of things, but not really feeling sick elsewhere in the body, certainly not running a fever. You know, the main thing that we want too as a healthcare system is for people that have symptoms to not come running to doctors' offices in the ER. We want them to pick up the phone, because if you're not feeling well and you're minimally symptomatic or symptomatic, but it's controllable and not getting very sick, whether you're a cancer patient or not, it would be isolate, stay at home, stay away. And we bring people into the emergency room, into medical care when they're having difficulty breathing, when they're having other types of pain or symptoms that are worsening, or really high fevers and can't stay hydrated. And those are the people that need to be in the hospital. If you walked into the Barnes ER right now and said, hey, I've got a cough and a little bit of a fever, but I otherwise feel fine, you wouldn't get in the front door. They'd have you off into a separate tent and things because they don't want you coming into the hospital. So that's a real important thing in terms of thinking of your symptoms, whether it's allergies or you think you might have a sore throat, you think your child may have, say, strep throat or an ear infection, but it could be COVID. It's, pick up the phone and talk to your doctor, your pediatrician, call one of the COVID hotlines that's on the Post Dispatch's front page and things like that to get more information.
So I agree with everything you just said, Ryan. The one thing I would add is that there doesn't seem to be congestion associated with COVID, and obviously allergies frequently are associated with congestion.
That's great to know. So, Dr. Rubin, you touched on this a little bit when you mentioned that the role that parents are playing at home of mom, dad, but also teacher, principal, caretaker. Can you talk a little bit from a pediatric perspective and what you're seeing at Children's Hospital of some of the negative implications of social distancing and isolation on patients and caregivers, more from a child's perspective?
Sure. And I think some of this is not just for children, but there are things that I would say are true for children. One of the things that happens in a child with a diagnosis of cancer is an isolation really from their I don't mean the physical isolation as in this regard as much as a developmental isolation from the rest of their peers. You can imagine that a child facing a cancer diagnosis and receiving cancer therapy is a child that actually is facing an element of mortality that their peers just don't face. And we talk about this a lot with our patients, particularly the kids who are, 10 or and above. And for them, it's the adult contact, particularly in clinic, those people that understand their diagnosis and understand what they're going through, that becomes really part of normalizing their condition. And I do worry that when children are stuck at home now, there's just an intensification of what they already feel in terms of not just physical isolation, but emotional, developmental isolation. Obviously, they can talk to friends by Zoom, and my own children have been doing that, or FaceTiming. But they have this other issue that even when they're going to school frequently makes them feel quite different. And so, I think that may have a special impact on kids. But I would need to have parents and children tell me that that's actually true. It's my concern about them just from knowing them. I wonder if I can ask a question, because it hasn't come up yet.
Please.
Which is, what are people's plans if they have a family member who has cancer for isolating somebody else in their household if they were positive? And
Amy, what do you think, Dr. James?
I think it's worth thinking ahead on that, and some of the recommendations about isolating a person who's been diagnosed in a bedroom, or having them use a separate bathroom, those work if you have a house or an apartment that accommodates that. Not everyone, you watch on the news, not everyone has a fully furnished basement where they can just go live separate from their family, and achieve that. So I think thinking through it ahead of time, and even if it alleviates your anxiety to think through who would you call if you needed help, who might take pets, who might bring you groceries, things like that. Because, we are potentially stuck in the household with whoever happens to live there. And if someone gets sick, that isolation, it has to happen to the best we can do it. So I think having a plan is really important on that. And realizing that we're all in this together. And even though we're sitting at home very isolated, we're all in this together. And knowing that there's resources in St. Louis that has come together really to rally and support our community. And there's friends and neighbors and other groups who might be willing to drop by groceries on the front porch or help with that. And then, as you guys have mentioned multiple times, calling the COVID hotlines, calling your care team if you're a cancer patient, and getting that input and that advice.
And so my follow-up question would be is, what if the member in the household who's diagnosed with corona is also the member of the household that has cancer, and how do you deal with that?
Yeah, I mean, I think we're learning a lot about particular types of cancer and patients that then become positive for coronavirus. I don't know that there's a universal message that says if you have cancer and you get coronavirus, then here's this sort of plan outside of some of the things we've talked about. Although I think that's, again, one of these very dynamic things that could change. Could a particular drug or medication really benefit a patient with a weakened immune system from being on active chemotherapy, benefit from an early intervention? Those are things that people are exploring and testing. And what are the implications for vaccination once a vaccine is developed, which is certainly a year or so away at the earliest. But those are all things that I think the scientific community in general is really thinking about and working on. So, fortunately, we don't have hundreds of cancer patients at Siteman that are COVID positive, but nationwide we do. So these registries are being created nationwide and worldwide to try to learn from these experiences and come up with good guidelines and potential treatment recommendations and interventions. But literally, if you look at, the flagship medical journal, the New England Journal of Medicine, on their COVID page, there are articles that come up every day relevant to a lot of these types of things. So we're learning on the fly.
And I would add, I just remind people that we routinely have to respond in our care for cancer patients to acute infectious disease, and that holding chemotherapy, delaying chemotherapy while people recover from acute infection is relatively common practice. And so I bring this up just so that people are reminded that chemotherapy, the schedule for chemotherapy and the doses of chemotherapy can be modified without compromising cure. And it's something that we do routinely around acute infectious diseases.
And Josh and Catherine, have any of your patients in particular tested positive for COVID? I have not had a patient of mine that I've either treated recently or in the past that I know of that's COVID positive, but I wonder if either of you have.
No, I haven't.
Yeah.
Yeah, so I mean, I think the rates are pretty low amongst our patient population, and we're not really seeing a lot of patients where we can trace their positivity to treatment or their coming in and out of the medical center right now in general.
Great. I think that's helpful to know. So we talked a little bit about community response and, just the major healthcare systems coming together with the task force to really share with the community what the systems are doing and how they're handling it and how they're collaborating. One of the questions we did receive is continuing to communicate to high-risk communities, the importance of social distancing, and what responsibility do we have either as those in the healthcare field or just citizens concerned about social distancing. What can we do from the comfort of our own home or own office to communicate the importance of social distancing at this time?
That's a great question. And I think it's role modeling and doing ourselves. I know as someone who doesn't treat patients, I do my part by staying in. And then if I did have to go out, I feel like I've reduced the risk for people who are out there having to go seek or provide medical care. Yeah, I would say role modeling, continuing to put forth that message, and hope that the majority of people can follow on it.
And I'd say just trying to be a good neighbor and good citizen. And if there's a community organization, a group, a religious organization that you're active in, you probably already know of efforts that they're doing that you may be able to help, whether it's grocery shopping for someone who would be higher risk to be in the grocery store, or whether it's, you know, cutting somebody's lawn, or who knows, there's so many different opportunities, but just being a good neighbor and good member of the community, and practicing what we preach. So, you know, wearing the masks when you're out and about. I've got my Pedal the Cause bandana mask that works real well, that was provided and we're using a lot of. And I think just taking the opportunities to check in on people, whether it's from afar, across the country that you haven't talked to or heard from a while, or one of your neighbors next door, and just making sure that people have what they need. I read an interesting article that says we're sort of out of the toilet paper freak out phase, and it's now like the hair dye freak out phase, and the board games and things that everybody wants and needs. So it's just, you know, it's nothing that we've ever gone through before.
It's so interesting that the shopping trends really tell where we are as a community, I guess. So in follow-up to that, and kind of hypothesizing where we might be in the future, we see a lot of charts and graphs and dates and timelines, but and things are moving up and moving back in time. But when, in your professional perspective, and I'll open this up to the group, do we expect the peak of hospitalizations here in the St. Louis metro region? And you know, what do you think we can anticipate in the coming weeks and coming months?
I'll be curious to hear what other people answer to this. The projections I've seen put the Missouri and the St. Louis peak in about, you know, closer to 2 weeks away, and that is really dependent on us and our communities being smart about social distancing and continuing to make those efforts. It's hard with all the data you see and all the news. You know, what's happening in one part of the country doesn't necessarily speak to what's happening here in St. Louis. And it sometimes seems like it's so close to us just because we might know people in other areas where that's dominating the news. But I think for St. Louis, what I've seen is probably a couple weeks away.
And I think one of the important things that people are going to need to keep in mind is that when they look at the numbers, particularly the national or international numbers, you can feel encouraged, for instance, that the United States overall numbers may be on the decline as New York is past peak now. But your risk is your local risk. It doesn't have anything to do with what happens in New York or Washington or any place else. It's your local risk. And so when people are projecting that the St. Louis peak is 1 to 2 weeks from now, and you might anticipate at that point that our national numbers will be looking good, our peak risk is going to be 1 to 2 weeks from now. It's not the peak risk of the US cases. It's not even the peak risk necessarily of Missouri as a whole. It's what's happening in St. Louis that's our risk. And people are going to have to maintain their vigilance through our local risk period, not necessarily something that mirrors the national or international numbers.
Right, and just to add to that, Dr. Rubin, is that once we get past that peak, it still takes a while for cases to go down and for that risk to diminish. So we can't just expect we're in an all clear once we hit a peak, because we still have to be vigilant about our behaviors.
I just put a link in the comments section that I think is a good resource that has a lot of these projections that comes from Johns Hopkins and the University of Washington with pretty good modeling. And I'd agree with Amy, a lot of the discussions at the hospital level here have been anticipating the peak in St. Louis to be kind of mid to late April and extend through mid to late May. We're making a lot of our decisions in terms of scheduling patients and things sort of pushed out to May 15th right now in terms of having some of these telemedicine visits and reducing exposure. And that might get pushed back a little bit as we get closer and the models become more reality. But I think I'd agree with Amy and echo those that we're sort of looking at a mid to late April to mid to late May sort of peak and then decline. But it doesn't mean that all of a sudden one day you're going to turn the TV on in the morning and to be like, okay, back to life as usual sort of thing. It's going to be a gradual reopening of both medicine as we know it and other aspects of society, I think.
Great, thank you. So we talked a little bit about the peak, and obviously the follow-up question is going to be about continued treatment, vaccine, and cure. Those are the words we're always looking for, is finding the cure. And there was a question about Calquence, a treatment for lymphoma, and the possibility that it could reduce the severity of respiratory distress. But we also know that there are trials happening here in the community at WashU, at Mercy. So can we talk a little bit about medical interventions and what we're doing to try to research and find measures to treat and hopefully future vaccines to prevent viruses like COVID-19. I'll open that up to anyone.
So I know they are starting a clinical trial looking at hydrochloroquine to treat at WashU. In terms of Calquence, I'm not familiar with that drug. I mean, I would say that all of these trials are just now up and going, and it's going to take a while before we can figure out what the real cure is going to be or treatment-wise. And as Ryan said, this is going to be at least a year off for a vaccination effort.
Yeah, I mean, I'll I guess address a couple things. I guess the first is testing. So there's a lot of testing in development. One of I think the most important two updates on the testing front and things on the horizon are a more rapid point of care test that'll roll out in a lot that can be done in 15 or 20 minutes, kind of like if you go to urgent care and get tested for the flu. That will be really effective in helping identify patients and containing little mini outbreaks, and then help contain re-outbreaks in, say, the fall or the winter. The second is the antibody testing that you probably hear a lot of that would test somebody to see if they've been exposed. And that would allow people who have been exposed and are then immune and shouldn't get reinfected with this type of virus to be able to be out and about and working and not having to worry about the same level of personal protection and social distancing. And that'll allow the world to reopen in all aspects of society. And then on the treatment front, there have been 4 or 5 different things, hydroxychloroquine and some of these other antiviral agents that are showing promise in certain scenarios. And as the numbers increase of patients who are part of these studies, we'll know more. And I think that'll be very effective. And then, of course, the sort of holy grail of all this, the vaccine development is well underway with unprecedented efforts. I'll tell an anecdotal story in a moment, but these are being tested already in phase 1 studies and probably a year away. We have a close friend who works for Pfizer. Pfizer has a huge presence in St. Louis. They have basically shut down all efforts with the exception of 50 drugs that are needed in the world and are focused on a vaccine. And they are pushing 4 vaccines at once, knowing that only one's going to work and they're going to waste the other 3 efforts. And they're making several 100,000 lots of each vaccine. So they're going to lose a lot of productivity. They would never normally do this in parallel. They do one at a time. And they're doing it because they're pretty confident that one is going to work. They'll test that one, it'll work, and then they can go into mass production. And the Pfizer oncology effort and the Pfizer drug development effort, everything else has kind of come to a halt in St. Louis, and they're really focused on this at both the employee and the manufacturing level. And it's been amazing to see that kind of commitment and dedication and how they're pushing it. But I think it sort of speaks to the ingenuity and the sort of American drive of being able to sort of do something like that and test it and get it out as soon as they can. They're basically taking what would be an 8 to 10 year effort and compressing it into a 8 to 12 month effort. So it's pretty monumental effort, and hopefully be successful and be something that then we see the fruits of, you know, a year from now, and some of these other adjuncts and testing and things will help us contain things better.
And Dr. Fields, go ahead, Dr. Rubin.
I'm sorry, I just wanted to address the one component of Rob T's question about the cutting inflammation. This is what I was alluding to way back in the beginning, the idea that there may be a component of treatment in the future that would involve controlling the inflammatory response. And so you can think about some of the medical approaches to managing rheumatoid arthritis or other autoimmune inflammatory diseases that in some aspects include immunosuppression as a way of reducing inflammation. And certainly we do that in a number of diseases.
Thank you. So one of the questions we had as you were talking a little bit about Pfizer and what's happening in their world is, when the vaccine does become available, should someone in active treatment get it, or do they need to wait?
Great question. Josh, what would you, because you deal with this a lot with kids and vaccinations.
I mean, we certainly do deal with this. I just want to qualify any answer I have by saying I'm not an infectious disease doctor, and there are lots of subtleties to this question. But there are certainly some diseases, for instance, chickenpox or varicella, where we would vaccinate while actively treating, in the hopes that we can enhance an immune response to fight the virus. But those are pretty limited. I don't know that again, I'm not an infectious disease doctor. I'm not really sure how frequent vaccination during acute treatment happens. And I would just sort of, I guess I would refrain from really answering that question in any way that communicates any authority.
I will add that from the public health perspective, where vaccination has such a large impact is it reduces the chance that those people who can't get the vaccine, who are immune susceptible, it reduces the chance that they'll run into someone who's infectious. So the power of vaccines is not just in protecting ourselves, it's in protecting the community. And such that, you know, we see this with other infectious diseases. If most people around are immune, then they're not likely to be transmitting it to the person who's susceptible and has the ability to be vaccinated. And that's why it's so important.
And Amy, that's sort of the same rationale for wearing a mask, right? It's not protecting you per se, it's protecting everybody else.
Right, right. So going out, you know, if you feel perfectly healthy and haven't been out, you know, still wearing a mask protects everyone around you as well as, you know, more so than yourself.
Absolutely. So we are approaching the 2 o'clock hour. So I would encourage, if we have any questions, to put those through the chat, the Zoom group chat, or through Facebook Live. And we'll try to answer those in our final few minutes together today.
I'd also just say, you know, if anything comes through or people have other questions or didn't feel like something was addressed, and, you know, happy to correspond with Stacy and Eleanor and Petal and answer things on a one-off, and not to put the Petal group on the spot, but happy to do another one of these in the coming weeks if it's helpful to the community. I think I speak for everyone, not just on the call at the physician level, but the Cancer Center in general, and the leadership here has been very supportive of these. And of course, Petal the Causes and their group outside of the bike ride is just one of the best advocacy groups we have for patients and resources in our region.
Thank you.
I
yes,
would,
go ahead. I'm sorry, Dr. Rubin, I didn't mean to cut you off.
I was just saying I agree completely and am similarly available.
Great. So I will offer this and then I'll go through a couple more questions. If anyone has any questions that they are unable to either type in or uncomfortable sharing, please feel free to send them to info@peddlethecause.org, and we'd be happy to facilitate those to the appropriate panelists to try to get you an answer. We do have a couple more follow-up questions, and one is about supplements and food that we can take to help and build immunity. Anyone have any suggestions as to additional at-home remedies that people can do to help with immunity and just general health?
I am always a huge advocate of healthy eating first and foremost. I can tell you that, we don't eat prepackaged food, and it's not because of anything other than I think fresh food is always better for you. I know not everybody can do that, and I think doing the best that you can is important. And I think that immunity in general reflects an overall state of health, and that eating well is a component of being healthy. Getting outside in the sunshine, I think, is an important component of being healthy. Again, I know not everybody can do that. With regard to specific supplements, there is certainly a many thousand years history of individual cultures using natural products to enhance their, wasn't always called immunity, but basically to enhance their health. I don't have any specific information in support or against any of those things. I think it's important for people to look at stuff for themselves, and anything that they think sounds right for them, that, as long as they're communicating with their doctors so that their doctors can be certain that there's no contraindication with regard to cancer therapies, and I'll mention one specifically in a second, that those are good things to do. The reason it's important to talk to your doctor is sometimes some of the supplements that people market for overall health and even immune health are antioxidants. And it's important to remember that oxidative damage is how radiation and chemotherapy frequently work. And so to take a supplement that is an antioxidant like vitamin E has the potential to actually diminish the therapeutic effect of your cancer treatment.
I have one follow-up question.
Can I add to that?
Yes, please.
Just to say, if you can find ways to work fruits and vegetables, and even if you do succumb to the occasional packaged food or chocolate candy, there might be a stash at my house, but finding ways to bring those fruits and vegetables, and I know that's hard right now. I just used up the last of my fresh vegetables last night, and now I'm on my freezer vegetables on that, because you're balancing that about how often you go to the grocery store, but finding ways to build that in the little bits that you can, and being active either outside or in your house to keep that up while we're working through this.
I just want to add that we should also exercise caution with those supplements, because sometimes they contain analogs that you in a plant-based form that you don't want to take. For instance, in breast cancer, a lot of those supplements do contain those phytoestrogens, and so women that are supposed to be taking anti-estrogens should definitely not be taking those types of supplements. So be cautious of what is in your supplements as well, because you could be counteracting your therapy.
Yeah, that's a very important point.
Yeah. And I think just like an athlete checking with their trainer or their coach, if you're a patient, especially if you're on active treatment, check with your doctor, make sure that they know anything that you're taking that would be considered a supplement. And, we get asked all the time about diet. And I think to Josh's point and everyone's, it's just eating a well-balanced, nutritious diet that's going to kind of get you what you need, is going to help with the immune system in general and keep you strong. And and I think staying active, you know, feeling like you're able to safely go for a walk or go for a bike ride, go for a run, being creative with home exercise and things to be able to keep your body functioning as it normally would.
Sure. And I think to balance that, we've talked about healthy well-being, but I think a healthy mindset and mental health is something we definitely deal with when we have a loved one who has a cancer diagnosis, or we ourselves are a caregiver, in addition to the anxiety of a virus around us and social isolation. So just a couple resources that maybe we could share between your insurance companies. If you're an employee, you might have an employee assistance program as well. If you want to shout out any resources available through Siteman Cancer Center or through St. Louis Children's Hospital that could be available to patients and their families, I think probably would be appreciated by the PEDAL community. So anything you want to share on mental health?
Siteman has a statement of, I just almost said oncology, but psychology service, and I don't have the number or the information off the top of my head. They actually have some nice tips on their webpage about dealing with anxiety right now, and some phone numbers to call.
And I would say, kind of as I was making the comment earlier, just trying to, you know, be a good neighbor. I mean, I think, you know, if you sense or feel like somebody may be at risk for, you know, the sort of effects of social isolation on their mental health, you know, reach out to people, make people understand that they have resources. We do that for our patients a lot, just to try to have them understand that there's a lot of resources, whether it's our office directly or through the Cancer Center, through some of the national organizations, some of the patient advocacy groups that we've been honored to be a part of, all have mechanisms to help.
Great. So I'm just gonna go through. We had someone, Rob T, mentioned a list of foods that they've been trying with supplements. So that's on there, as well as Kelly O'Neill mentioned virtual support via Cancer Support Community. So lots of online resources, as well as information on, oh, Eleanor just posted the link to Siteman Treatment's free psychology services, as well as Dr. Glover Collins just posted the psychology service line for Siteman. And obviously, if you're a parent, you know 454-KIDS, you call Children's, get a nurse on the line, and they can direct you to services that are available through St. Louis Children's Hospital. Obviously, I'm a mom, know that number by heart. So we are right at 2 o'clock. So if anyone has any additional questions, feel free to pass them through quickly. Otherwise, feel free to send them to info at pedalthecause.org. I would like to thank our esteemed panelists and friends, Dr. Ryan Fields, Dr. Catherine Glover Collins, Dr. Amy James, and Dr. Joshua Rubin, who are here today to talk about the coronavirus and the impact that it has on those with a cancer diagnosis, but also our community. On behalf of Pedal the Cause, I'd like to thank everyone for joining us today, as well as everyone in healthcare who is out in the field right now, keeping us safe and supporting our community. You know, we just need to continue to band together, and hopefully Pedal the Cause and all of our physicians are here for you, to support you. And to Dr. Fields' point, we'd be happy to offer these again in the future if there's interest. So if there's other topics of interest, again, send those to info@pedalthecause.org, and we'll see what kind of bandwidth we have. But while we can't be together in a community, know that virtually we are here to stay connected with all of you, to keep you all safe, and that you all are in our thoughts and minds. Be safe, be well, and thank you for joining us today. Thank you.
Thank you.
Thank you, everyone. Bye-bye.